So let's tackle one of the most practical issues: how to optimize your diet to boost metabolism. Does anyone have the experience that when you were in your 20s, you were able to eat anything you wanted without gaining weight? And several years later, boom, you seem to be gaining weight from just breathing air. And that struggle is real for many people. And unfortunately, excuses do not burn any calories. That's right. I wish they did, but they don't. So we better look at the science. In addition to the classical energy balance, we'll be covering 4 major aspects of nutrition. First, meal timing. That means we'll explore whether eating meals at certain times of the day is better than eating them at other times. Second, how many meals should we eat each day? Are snacks good for you, or should we eat fewer meals? Number 3, is it important to eat your meals at regular or consistent times? And number 4, what should you eat if you want to boost your metabolism? So let's start with the first aspect of nutrition. When is the best time to eat? Meal timing has been shown to be an important aspect for our circadian rhythms and metabolism. If you eat the same meal in the morning and in the evening, then the metabolic effects of the meal will not be the same. They will be different. You will deposit more fat from the meal when you eat it in the evening. People who consistently eat breakfast every day are usually leaner than those who usually skip breakfast, in spite of the fact that people who consume breakfast every day usually have a higher caloric intake than those who skip breakfast. In one weight loss study that involved 420 participants for almost half a year, the researchers divided up the group into the early eaters who were starting their meals earlier and also finished their meals earlier in the day, and the late eaters. And guess what? The early eaters lost more weight with the same diet in both groups. So the meal timing plays a crucial role in weight management. Also, the data from the health professionals follow-up study that included more than 29,000 US men showed that men who skipped breakfast had at least once a week had a 20 to 39% higher risk of developing type 2 diabetes compared with men who ate breakfast every day. And that's including all kinds of breakfast. That includes eggs and bacon. That includes all kinds of breakfasts. Just eating breakfast was protective against developing diabetes. And the same researchers combined eating breakfast and also meal frequency. So we have 4 groups, eating breakfast, yes or no, and combining them with eating 1 to 3 meals per day and eating 4 to 7 meals per day. So eating breakfast and eating only 1 to 3 meals per day is a reference group. And which group do you think was the worst off? We know that not eating breakfast will be worse than eating breakfast, but what about the frequency of meals? Is it better to eat 1 to 3 meals per day or 4 to 7? You can put it in the chat box. Type in 1 to 3 or 4 to 7. Which one is it? Well, the worst off was the group that was not consuming any breakfast and that was snacking, that was eating 4 to 7 times per day. Their risk of developing type 2 diabetes was 37% higher compared to the group eating breakfast and eating only 1 to 3 times a day. And in one model, the risk was even doubled. So the risk was twice as high compared to eating breakfast and eating 1 to 3 times a day. Now, breakfast is an important meal for people who have type 2 diabetes. This study by Daniela Jakubovic has shown that breakfast consumption decreases glucose levels by 20% over 24 hours of the day. And that's due to the higher insulin secretion by 20%. So does this mean that we should be eating breakfast every day? Absolutely. And what if you're not hungry for breakfast? Well, let me ask you, what did you have for dinner last night? Maybe everything was vegan, maybe everything was delicious, but maybe it was just too much food. So next time, make dinner the lightest meal of the day. Extra points if you can even skip dinner, and you will feel hungry in the morning and you will be looking forward to eating your breakfast. And this inspired us to try out this model. There's one group of people who are recommended to eat smaller meals during the day, and that's people with type 2 diabetes. But what would happen if they ate fewer meals that would be aligned with their circadian rhythms? And to answer this question, we conducted a randomized crossover trial and compared 6 small meals with only 2 meals a day, breakfast and lunch, in people with type 2 diabetes. The diet composition and the energy intake were the same in both interventions, and we published the findings in Diabetologia, one of the leading journals in diabetes care, and even designed the cover. And let me briefly share the results with you. The results are shared as the direct comparison of the change on 6 meals a day, A6, and 2 meals a day, B2. If the columns are going down, it's a decrease. If they're going up, it's an increase. So for body weight, we can see a decrease on both regimens, but people lost more weight on 2 meals a day. And the same for liver fat. People lost more liver fat on 2 meals a day. Insulin sensitivity went up more on 2 meals a day, which is a good finding. A1C improved about the same in both. Fasting plasma glucose and fasting insulin decreased more on 2 meals a day, so their diabetes got better by all these parameters. And surprisingly, the depression symptoms got better, were reduced on 2 meals a day compared with 6. And also, what was really striking was the difference in hunger feelings. So in the beginning of the study, many participants were hesitant to join the study because they were concerned they would be feeling hungry all the time. But guess what? They felt less hungry on 2 meals a day compared with 6. Because if you're eating 6 meals a day, the meals are small in order to stay within the caloric intake, and you never get really satiated. So you feel kind of hungry the whole day. While on 2 meals a day, you're able to eat, until you're satiated. Although there's periods of time where you don't eat anything, it produces less feelings of hunger. And last year, just after COVID hit, one of my friends reached out to me, one of my patients who has type 2 diabetes. He reached out to me and he was like, well, due to COVID, I gained some weight. What can I do? And I shared with him the findings of the study. And without changing the composition of the diet, he immediately implemented eating 2 meals a day, only breakfast and lunch. And this is his body weight. And he lost 10 kilograms or 22 pounds in only 8 weeks. And he was like, well, this was like super smooth. I wasn't expecting such a success in only 2 months. Surprise, not, this is not surprising when we take all the science in account. But surprisingly, before the world's oldest man died at 114, Walter Bräuning attributed his longevity to eating just 2 meals a day, working as long as he could, and always embracing a change. So eating 2 meals a day may also be associated with longevity. It's because we're aligning the body clock with the circadian rhythms. And that brings us to the next question. How many meals per day should we eat? We kind of touched on it in this first part, but let's look into snacking. Snacking has been suggested as one of the strategies for weight management and also glucose control in people with type 2 diabetes. But eating more than 3 meals a day has been shown to increase energy intake and also increase the risk of obesity and type 2 diabetes. Snacking increases the food stimuli and also hunger and desire to eat. And in the healthcare professional study, eating frequency was associated with an increased risk of developing diabetes. Those who were eating 4 to 5 meals a day had a higher risk of developing diabetes by 4 to 18%, depending on the model, compared with 3 times a day. And that inspired me to look into this topic in Loma Linda, one of the blue zones where people live the longest and are the healthiest on Earth. I went there to do my postdoctoral fellowship at Loma Linda University and analyzed the data for more than 50,000 participants of the Adventist Health Study 2. Now, what we found out was pretty striking. We looked at the meal frequency and timing and weight management over the course of 7 years, more than 7 years of follow-up. We found out that there was a linear relationship between the number of meals and the change in body weight. Eating 3 meals a day is our reference group, and you can see that people who were eating 4 or more meals per day were gaining weight compared with people who were eating only 3 meals per day. And notice the group that was eating 2 meals a day. They were better off. They were relatively to the group eating 3 meals a day. This was better for their weight management. It was associated with a lower body mass index during follow-up. There was also a small group that ate only 1 meal per day. However, for most people, this may be super challenging and probably not long-term sustainable. This was only a small group, so I wouldn't like to draw any far-reaching conclusions from this particular group. However, the group eating 2 meals a day, was a good-sized group. Now, consumption of breakfast was protective against weight gain, and the timing of the largest meal was an important factor. Those who were eating breakfast as their largest meal had the best weight management compared with those who ate lunch as their largest meal or dinner. And the last important factor was the length of night fast. Having at least 18 hours of night fast was associated with the best weight control compared with shorter night fast length. So when we summarize these findings, we just confirmed the ancient proverb: eat breakfast like a king, lunch like a prince, and dinner like a pauper. Now let's move on to the third aspect of nutrition, and that's regularity in your meals. Are we supposed to have regular or consistent times for our meals? And to answer that question, one Swedish study that analyzed 3,600 adults found out that regular eaters were leaner and had a 37% lower risk of developing metabolic syndrome compared with those who were eating their meals irregularly. Now, another study also analyzed specific meals. So looking at breakfast regularity, one observational study of 1,600 middle-aged adults showed that irregular breakfast increased the risk of developing metabolic syndrome by 34%. And what about lunch and snacks? Well, a prospective British study that included 4,300 adults found out that irregular lunch was associated with a 42% increased risk of metabolic syndrome. And what about irregular snacks? What do you think? Yeah, they also increased the risk of metabolic syndrome by 35%. So it turns out that having consistent times for your meals really pays off. And coming to the last aspect of nutrition, what should you eat to boost your metabolism? Well, this topic seems to be a jungle. The headlines are advocating for different diets, and it looks like we need a direct comparison between these dietary patterns in order to decide which one works best. So, the most frequently referenced dietary patterns are the keto diet, the Mediterranean diet, and the vegan diet. Do we have any head-to-head comparisons between these diets? And it turns out that we do. Let's start with the comparison of a keto and a vegan diet. Let's look at the study that was conducted by Kevin Hall and that was funded by NIH. And he did a crossover trial, and each intervention lasted 2 weeks. For 2 weeks, people were on an animal-based low-carb diet, or they started with a plant-based low-fat diet. And after 2 weeks, they switched. Those on the plant-based diet switched over to the low-carb diet and vice versa. Now, how did the diets look like? The keto diet contained 75% of fat and only 10% of carbohydrate. While the vegan diet, the opposite, 75% of carbohydrate and 10% of fat. Now, the energy intake, was fairly comparable between the diets. The spontaneous energy restriction was almost 700 calories per day after the 2 weeks on a vegan diet, which would make it really easy for people to lose weight on a vegan diet in the long term compared with a keto diet. But again, in the beginning of the study, the caloric intake was completely comparable. So this is just after switching to a vegan diet that the caloric intake decreased, in spite of people reporting to be full. And the body weight, there was a sharp decrease in the first week on a keto diet compared with the vegan. On the vegan diet, the people started losing weight in the second week, but it seems like more time would have been beneficial. But now, what did people lose on the keto diet? Was it the fat that they needed to lose? Unfortunately, it was not fat. You can see that in the first week when they lost most weight, their fat content didn't change, whereas people on the vegan diet lost fat even in the first week and more so in the second week. So they were not losing fat. What were they losing? Well, look at this. They were losing muscle. So the keto diet really promoted loss of muscle, which is not what we would like to see, right? That's not a healthy weight loss. So we can say that the findings suggest that a vegan diet worked better in terms of a lower caloric intake. That's important for the long-term weight management. And in spite of a slower weight loss, the participants were losing fat on the vegan diet and muscle on the keto diet. So the vegan diet worked better for a healthy weight loss. Now, what about the comparison between Mediterranean and the vegan diet? To answer that question, we conducted a crossover trial that lasted 36 weeks. For 16 weeks, the participants started with either a Mediterranean diet or a low-fat vegan diet. And then after 16 weeks, they had a 4-week of a washout period and then switched over to the opposite diet. What did we find out? People lost much more weight on the vegan diet, but that's not the whole thing. They also lost more visceral fat, more fat mass in general. Their blood lipids improved more. Their insulin sensitivity improved more, and blood pressure improved on both diets, more so on the Mediterranean, but this was the only outcome that improved on the Mediterranean diet. So when we take all these results in account, then the vegan diet worked better than the Mediterranean diet for all the cardiometabolic outcomes. The vegan diet not only helps with energy intake to decrease energy intake, but it also increases energy expenditure. We know that out of all the energy expenditure in a day, 70% are due to basal metabolic rate, about 20% are due to physical activity, and 10% are in response to food intake. That's the so-called thermic effect of food. And the thermic effect of food is the release of energy once we eat a meal. So this is breakfast, lunch, and dinner, and we can see an increase in energy expenditure, and that's the thermic effect of food, the release of thermic energy, the energy in the form of heat when we eat a meal. Especially now when it's getting chilly, you know, when you eat a meal, you warm up. So that's exactly what's happening after each meal. Now, is there any difference between people who are lean and obese? And it turns out that in obese people, the thermic effect of food is lower compared with lean people, 9% of energy expenditure compared with 15% in lean people. Now, is it due to the obesity, the adiposity, or is it due to the insulin resistance? This study tried to tease out both of these, and it found out that it's both. Both insulin resistance and also the adiposity will decrease your thermic effect of food. And what kind of, and since we know that you know, both of these factors are important, what does it mean in terms of what the diet should look like? Comparing a low-fat and a high-fat meal, the high-fat meal had a lower thermic effect of food by 32%. The low-fat meal resulted in a 32% increased thermic effect of food compared to the high-fat meal. And what about the quality of fat? Does it make any difference whether you eat butter or whether you eat olive oil? Absolutely. Saturated fat had a lower thermic effect of food compared with MUFAs and PUFAs, the monounsaturated and polyunsaturated fat. And another aspect that plays a role in the thermic effect of food is processing. One study found out that a processed sandwich that included white bread had a lower thermic effect of food compared with a whole grain sandwich. So taking all these aspects together, would a vegan diet that emphasizes the consumption of unprocessed foods, that also is low in fat and includes the healthy sources of fat, would that kind of diet make a difference in the thermic effect of food? What if people went vegan? Would that affect their thermic effect of food? In 2005, Dr. Barnard showed a 16% increase of thermic effect of food on a low-fat vegan diet. And we decided to give it a try and test the low-fat vegan diet for 16 weeks, comparing a low-fat vegan diet that included fruits and grains and legumes and vegetables with a standard American diet. And we measured the energy expenditure using indirect calorimetry. That's a machine that looks like a spaceship. You just come into our lab, you lay down, and we place this clear hood over your head. And you breathe normally, and we measure the carbon dioxide output. Based on that, we're able to calculate how many calories you're burning. And we measured that in the fasting state, but also after standard breakfast. We were also sending our study participants to Yale University, to Drs. Schulman and Peterson, who performed magnetic resonance spectroscopy of the liver and of the muscle, measuring the liver and muscle fat content. Now, on the vegan diet, the participants lost 6.4 kilograms, which is about 14 pounds. So about 1 pound a week was the weight loss. And liver fat was reduced by 34%. Also, muscle fat was reduced by about 10%. Insulin resistance dropped on the vegan diet. And the thermic effect of food, which was not affected in the control group at all, increased by 14% on the vegan diet. So a plant-based diet really boosts your metabolism, but you need to take all the aspects in account, emphasizing the unprocessed foods, keeping the fat content low, and emphasizing the healthy sources of fat. So in summary, the important pillars of a diet that boost your metabolism are, first of all, eating early in the day, which aligns the body clock, the clock genes, and the circadian rhythms. Second, eating breakfast like a king, lunch like a prince, and dinner like a pauper, which means that consuming 3 meals a day with no snacks between is better than eating many small meals during the day. And, due to the increased fat deposition in the evening, dinner should be the lightest meal of the day, and extra points if you can skip dinner completely. Number 3, eating meals at regular or consistent times seems to be beneficial compared with eating your meals at irregular times or having erratic eating habits. And number 4, a plant-based diet that emphasizes low energy foods such as fruits and vegetables, grains and legumes, reduces caloric intake, but also increases the thermic effect of food and thereby boosts your metabolism. With that, I like to encourage all of you to give these concepts a try and to put them to the test. Because with the right information, we can all optimize our diet to boost metabolism and we can all win. Thank you for your attention, and I'll be happy to take your questions.
Thank you so much. That was so incredibly informative. And personally helpful for me, as well as I'm sure everyone else listening on the conversation. And I know we're going to share that all with our patients and with our friends and family and everyone around us. That was just incredible. So I'm going to kick off by asking, what exactly is breakfast? So this seems like quite a straightforward question, but quite often we wake up and we brush our teeth and we do a bunch of things. What's actually defined as breakfast?
Yeah, that's an excellent question. There's a few ways how to answer that question. The first way is that it's the first morning meal that's eaten before 10 a.m. But you can say, would coffee count as breakfast? Would that count as, if it doesn't contain any nutrients? So the second important aspect of defining it as breakfast is that it needs to contain calories, and breakfast should contain at least 30% of your daily calories. So technically, even if you eat an apple for breakfast, or just a small bar, to get you started, would technically not count as breakfast when we consider this comprehensive definition. So it's a morning meal eaten before 10 a.m., but it also contains calories, and at least 1/3 of your calories should be coming from your breakfast.
That's incredibly helpful to know as well. And someone asked in the chat, I have a feeling that what I'm thinking might be the answer for this, but they're saying, does this apply to younger people as well? Obviously not small children, but what if the person who asked this has got teenage boys? They obviously burn a lot of calories, they're very active. Would you recommend shifting meal times earlier as well for people of that age?
Absolutely. Eating breakfast has been shown beneficial for all age groups. And I'll just tell you an important aspect, and that's our brain function. So children have better ability to score on their tests when they eat breakfast. One study looked at college students and looked at whether they ate breakfast before taking the test. And even in college students, eating breakfast, significantly improved the academic performance. So I would really encourage all of you to, incorporate a healthy breakfast into your daily routine. It's been also shown for beneficial for brain function in adults. Also, age doesn't really matter. Our brain needs a lot of glucose. So when we are starting the day, let's give our brain what it needs so that it can perform well.
No, that's really helpful. And I know PCRM, you as Director of Clinical Research, PCRM has so many great resources, as does plant-based health professionals, in terms of recipes for breakfast. And we have a 21-day challenge. There are similar things that PCRM offers. So if you're new to kind of learning about plant-based diets, do go and check those out, because there's lots of really good breakfast ideas. If you're wondering, what do I do without my eggs or my bacon? There's so many options there. So one of the things that's become quite sort of in vogue is, as you mentioned, intermittent fasting. You see all these apps, and lots of people are trying intermittent fasting. What are your views on things such as the 5-2 diet, or fasting for 1 day a week? Those sorts of things, or maybe even a few days a month. Some people do longer term fasts like that. What are your views on more sporadic fasting like that?
Yeah, all the intermittent fasting regimens have shown some benefits. So if 5-2 works better for you, if fasting once per week works better for you, just try it out. But it's also, keep in mind that it's like with exercise. If you exercise only once a week, let's say you go for a hike, on the weekend, it's great. But we know from research that incorporating exercise on an every day or at least every other day basis, even if it's smaller amounts, even if it's just going for a walk for 20 or 30 minutes, but if it's every day, it'll give you more benefits than just going for one hike on a weekend. And it's similar with fasting. If you can fast, 1 day a week, that's wonderful, or 1 day a month, you will get some benefits. But the 2 meal-a-day regimen enables you to incorporate the intermittent fasting on an everyday basis. And, I understand that it may not be ideal for everyone. For those of you who really need their dinner because they're hungry, just keep the dinner the lightest meal of the day. And maybe occasionally, once a week or twice a week, you may skip your dinner completely to get these extra benefits of intermittent fasting.
So that's really helpful. One of the questions is actually about non-diabetic people. In non-diabetic people, do you still recommend 2 to 3 meals a day, or 2 meals a day? I've recommended regular intake to help keep blood sugar levels stable and reduce cravings, especially for women. As you mentioned, that's kind of the current thing that we're told, that regular eating helps maintain blood sugar levels throughout the day. What are your views on that for people who are, say, fit and healthy, no metabolic issues otherwise?
Yeah, that's an important question too. So intermittent fasting and eating only 2 meals a day has been shown beneficial not only for people with type 2 diabetes, but if you remember the slides from the Adventist Health Study 2, those were healthy people. And so it's important for weight management. It may help with some extra pounds gained over the course of life. It may be beneficial to also strengthen your immune system. We know that after 16 hours of fasting, you turn on autophagy process. That means your immune system will get rid of all the immune cells that are not working properly. We'll just do like a cleanup. And it's like pruning an apple tree. If some branches are not producing enough apples, you prune them, and then the whole apple tree will just produce much more. And that the same happens to your immune system. So there are many aspects why 2 meals a day would work better, also for people who don't have any diabetes, for many different aspects of health.
So that's really helpful. And a lot of the people listening are health professionals, as that's one of the main audiences we try to reach. And I know that there are medical students here and people working a lot of night shifts. And I know that the field of chronobiology has been looking more at night shift workers and looking at how meal timings can actually help reduce their risk of longer term chronic disease. Do you have any thoughts on people who are working night shifts and what they can do, because it might not be possible for them to not have dinner?
Yeah, night shifts are an important topic. We know that working night shifts increases your risk of cardiovascular disease, obesity, and diabetes. But is it because of the shift of your sleeping patterns, or is it because of your meal intake that's also shifted? So it turns out that the meal intake plays a major role in this increased risk. So what you can do if you're working night shifts, align your meals to the circadian rhythms as much as possible. So that means if you're, for example, starting your night shift at 8 p.m., then you can eat your meal before you start, let's say at 6 p.m., and then not eat until the morning. By that time, your night shift will be over. You can have breakfast and then go to sleep. So your sleep pattern will be reversed, but your meal patterns will stay aligned to the circadian rhythms. I know that sounds weird, but eating meals at night is an independent risk factor. So working the night shift per se doesn't have to be as harmful. if you do your best to align your meals with the circadian rhythms.
That's so helpful. I think just, knowledge is power, and just knowing this and knowing that there could be something you can do could be so helpful. And you beautifully explained kind of the issues with snacking and increased opportunities to overconsume. But what about people, including, I know there'll be some people listening, who are on a strict whole food plant-based diet, who are already eating, really just whole plant foods most of the time? How about snacking on things like carrot sticks or pieces of raw fruit so that they can, get in all those nutrients? What are your thoughts on that? So they just can't fit that volume of food in a meal, but they want to kind of have some salad and fruit throughout the day. What are your views on that?
So studies on snacking have shown that even healthy snacking increases your hunger and desire to eat. So usually people who snack also consume more calories without even realizing it. I would suggest, just give it a try and compare a different system and see what works better for you. Each one of us is different. Each one of us has also a different time, to allocate for breakfast and lunch and dinner and snacks. So I understand and I recognize the differences. But in terms of health, I would suggest you give it a try to eat only 2 to 3 big meals per day and just skip the snacks and drink water instead. And try it out for a few weeks and see if it works for you specifically. It also depends on what the outcome will be. If you are a lean and super healthy vegan, don't have any health aspects in mind, one aspect that you may consider is the freedom, from just preparing the snacks so that they're ready to go. Taking care of only 2 meals a day provides you with a lot more time, to do other things that you enjoy instead of, being concerned about the meals all the time. That's one of the benefits that our study participants were reporting. Wow, 2 meals a day. I only need to prepare breakfast and lunch. I cannot believe it. I used to be packing, snacks all the time. Now I only prepare 2 meals. So it makes the logistics easier. And see if it works for you. Particularly if you skip the evening meal, the quality of your sleep will improve dramatically and you will feel much more better. So, give it a try, no pressure.
No, I love that. I think, definitely just giving it a try and seeing how it goes. I'm just firing so many questions at you. I'm going to launch our poll just to get everyone's feedback on the session, because we've had some amazing comments before people disappear. But I have a few more questions, if that's okay, because everyone has just loved this topic and is really excited to have you here. I know that you're very busy and you did a talk yesterday, another talk on another area of interest of yours of non-alcoholic fatty liver disease as well. So we'll have to get you back to cover that topic for us at some point, I think next year. One of the questions that's come up is, if one tends to exercise first thing in the morning, fasted, is it less beneficial than exercising after breakfast, so postprandial?
It depends on what health benefits you have in mind. So exercising before breakfast is wonderful to boost your metabolism and start your metabolism. We know that the post-exercise increased energy expenditure lasts for a few hours after that, which means that the exercise will take care of the blood sugar fluctuations, whether you're diabetic or not. But I mean, after breakfast and after lunch. So it gives you extra benefits, to start with exercise in the morning for your metabolism. For people who are diabetic and who have major fluctuations of their blood sugar after the meals, they may consider going for a walk after each meal to bring down the blood sugar. So exercise at any time is beneficial, and depending on the outcomes you have in mind, either the early morning exercise that's the most beneficial for your metabolism, or the post-meal walks for people who want to bring their blood sugar down would be beneficial.
That's great. So a lot of people are saying it's amazing and they want to know, if you had to choose then 2 meals for breakfast and the evening, what would you be able to give us an example? Obviously on a whole food, plant-based, no oil diet, you do need a greater volume sometimes of foods to get the calorie intake, especially for people who are very active. So do you have any ideas on what would be a good breakfast or dinner or lunch that you would recommend?
Absolutely. So when we look at the power plate, the vegan power plate, that includes the fruits and vegetables and grains and legumes. So ideally, we want to hit all those categories in a day. And if you have only 2 meals, that's still easy, because you can have oatmeal with fruit and sprinkle your oatmeal with some seeds, let's say, or a few nuts. Be careful not to overdo it with nuts and seeds. Those are, extremely helpful sources of fat, but still sources of fat. So don't overdo it with those. But then you're hitting grains and fruits and nuts for breakfast. And then for lunch, let's say you can have beans and veggies with rice or potatoes or sweet potatoes, and that would be your lunch, and you're hitting all the categories, all the major food groups.
That's super helpful. And as I mentioned before, there is a plethora of resources on pcrm.org and on pvhp.uk, to suit everything. So we have our 21-day challenge also includes a lot of foods from different cultures as well. So, if you're, for example, in Asia, there are so many examples of savory dishes that include lentils and beans and things, and that's really common. So you could even get your legumes in your morning meal if you have a savory breakfast. Even things like tofu scramble or, a sprouted grain and lentil bowl. There's so many things, so many options out there. We could just talk all day about the food options. Really, there's no short supply of that. So you touched briefly on drinking water in between the meals. Are there any other tips for drinking water or black tea or black coffee or herbal tea? Do you have any thoughts on the best times to consume those, and your views on, on caffeine as well would be great.
Mm-hmm. Yeah, depending on your habits, but also on your sensitivity to caffeine. Caffeine has a half-time of about 6 hours. So many people find out that when they skip caffeine completely, their sleep improves. So even though you may have coffee in the morning, you are still under influence of your caffeine when you're going to bed. And especially if you're drinking coffee after lunch or in the afternoon to overcome the afternoon sleepiness, then you may compromise the quality of your sleep. So my recommendation would be try it without caffeine altogether. If you like to drink hot tea, you may try like fresh mint tea, which is delicious and doesn't contain any caffeine, or there's many more kinds of herbal teas that don't contain any caffeine. Yeah, you may want to consider the quality of your sleep, and once you experience how refreshing the sleep is without caffeine, I think you will be sold.
Yeah, I'm with you on that for sure. For me personally, I'm very sensitive to caffeine. So I think it's a great thing just to be more mindful of. I know everyone is different on that. I think we've covered almost all the questions. I'll see if there's anything else, but I've really asked you a huge amount. And one last question to wrap up. Well, 2 last questions actually. One is it true that metabolism declines with age? A lot of people feel that they gain more weight, particularly women going through the perimenopause or menopause. What are your thoughts on that?
Yeah, that's an important question. And I wanted to mention in the study where we measured metabolism, uh, you know, our study participants were in their 50s and 60s. So that's exactly what they were reporting. They were like, my metabolism has just slowed down so tremendously in the past couple of years. And guess what? After switching to a low-fat vegan diet, the metabolism speeded up again. So yes, there may be a slowdown of your metabolism as you age, but we are not helpless. You know, we have some power over this with our diet.
That's really helpful to know. And then just finally, just to ask you, what are you working on at the moment, and how can people keep up to date with your work? Obviously, you've led some incredible clinical trials, and I know you're really involved with kind of actually influencing the guidelines around type 2 diabetes as well. But would love to know how we can follow your work.
Yeah, thank you for this question, Rohini. Right now, we're wrapping up a study for women with hot flashes and looking into the power of a low-fat vegan diet that also includes eating soybeans every day, cooked soybeans for the isoflavones, and the power of this diet to help reduce the hot flashes in postmenopausal women. We also have some free webinars for the public. So if you are in this age, or if you have patients who would benefit from this information, look up the information on the PCRM website, because we have free webinars for the public also on this topic.
That is absolutely fascinating. We definitely need more research into menopause, and obviously always great to keep giving out the message of that soya is beneficial for all ages and stages as well. So yeah, really, really excited to hear that. And I'm sure I'll send a link out as well to PCRM with the email, and make sure that everyone's signed up to the brilliant emails. There's lots of great resources on there. Someone asked about the recordings. So the recording of this session will be available for PDHP members on our website in a few days. So do join us. We take members from around the world. We have members as far as Australia to Europe to North America. So you're more than welcome, even if you're not a health professional and you're just a supporter. That would be wonderful. And I will also be circulating the slides to everyone who's attended, and the CPD certificate as well. So thank you again for joining us. These webinars couldn't happen without all of your support. So thank you. And a special big thank you to you, Dr. Kahleova. It's been one of the best webinars we've ever done. I think people are, the comments are brilliant. I'm going to send you them afterwards. But just thank you so much again for sharing your wisdom with us, because a lot of people who are already plant-based who are watching, I'm sure have picked up some tips on how they can take it to the next level and just optimize their meal timings to support their health better.
Thank you so much, Rohini. It was a pleasure to be here with you.
Thank you. Good night, everyone, and see you in a couple of weeks for our next webinar. And remember, we do these fortnightly, so hope to see lots of feedback soon. Good night.